Hi everybody, I'm Dr. Fuentes from the Fuentes Cosmetic Surgery Center. I've been asked what is the difference between a septorhinoplasty and a rhinoplasty. Well, a septorhinoplasty includes the septum removal when you do the changes on your nose. A rhinoplasty means just changing the external aspect of your nose. So the septum is a piece of cartilage that separates the one side from the other of the nose. Sometimes the septum is deviated. As a matter of fact, it is deviated in 95% of the population. But sometimes you can see that deviation outside, which is often due to trauma. Most often sports, altercations, things like that. So when the septum is deviated, we correct the deviated septum together with the change of the external aspect of the nose. But we could do a rhinoplasty without taking the septum out if there is no external deformity. In my opinion, removing the septum alone does not improve the breathing. For you to improve the breathing in a septoplasty or removal of the septum, you also have to remove the turbinates. And the turbinates are these projections that are on the inside of the nose, and they regulate the flow of air. They get big when we have sinus problems, when we have allergy reactions, when we have colds. So if you do not do something about the turbinates at the same time you do something about the septum, you will still continue having difficulty breathing. The problem in general is that the turbinates, when we remove them, tend to regrow. So when we correct the deviated septum for people who have difficulty breathing, these problems tend to reoccur. Now, as a plastic surgeon, I am not very keen on removing the septum for unnecessary reasons, because very often I utilize the septum as a graft for nasal reconstruction. Let's say that you have a scoopy nose. Let's say that I need teeth grafting. I use the septum for that. There are other cartilage alternatives, such as the ear, for nasal reconstruction, but the first preference is the septum. So I hope I was helpful in explaining the difference between the rhinoplasty, which is just working on the external aspect of the nose, meaning you have a hump or you like the tip. That's a rhinoplasty alone. And the septorhinoplasty means correcting the septum at the same time. Thank you for your time. Nice talking to you. Bye.